2019 Conference for Librarians of Western Australia. This is the seminar for the lifting and bending manual handling techniques. So, let's start off by having a look at some of the statistics for workplace injuries in Australia. In 2016, 6.4% of all claims lodged were related to back injuries. Specifically, muscular stress from carrying, lifting, and putting down objects made up 62.9% of all musculoskeletal disorders. So let's have a quick look at how they are caused. If you look at the screen here, we have a list of tasks which include repetitive movements, repetitive or sustained force, sustained or awkward positions, high or sudden force, and exposure to vibrations. We'll be focusing on the first three for the bending and lifting manual handling techniques. So, as librarians, what are your risks with your day-to-day tasks? Well, one answer to this question is the bending and lifting of books and resources you do on a daily basis. So first we'll focus on lifting in the library. Let's have a look at a short clip of our librarian, Janet.
Here we see Janet protracting her shoulders and excessively flexing in the thoracic spine. This is generated by contraction of the rector spinae muscles, which include the iliocostalis, longissimus, semispinalis, as well as compression of the transverse abdominis. We also see Janet's feet together and knees in full extension, locking the pelvis into a posterior tilt position. This changes the alignment of the back and center of balance in the abdomen because the spine has to support both the weight of the upper body and the weight of the load being lifted. As a result, this increases muscle fatigue to the rectus spinae, causing tremendous pressure on the lumbar vertebrae.
As seen in that clip, our librarian Janet has picked up a pile of heavy books with the wrong lifting techniques. What we could see was Janet had extreme contraction of the shoulders, extreme flexion of the trunk, no flexion at the knees, and with her feet together. Now we'll watch a clip of Janet with the correct lifting technique.
When lifting, Janet should keep her feet shoulder-width apart and contract the muscles of her abdomen concentrically, which include the rectus abdominis, external and internal obliques, as well as her rector spinae muscles eccentrically. This will help keep her back straight when lifting the object. Next, Janet will plantar flex her ankles concentrically to control the action of gravity. The muscles used in this position are her tibialis anterior, extensor digitorum, and hallucis longus and fibularis tertius. She will then extend her knees concentrically. This is generated by her hamstring muscles, specifically the bicep femoris, semitendinosus, and semimembranosus. Lastly, Janet should extend her hips concentrically, which is generated by her iliopsoas.
So, since we've looked at lifting, let's move on to the bending side of things. Again, we'll watch two clips, the first with a poor bending technique and the second with a corrected bending technique.
In this position, Janet's posture is characterized as extreme protraction of the shoulders, which involves the shoulder girdle. This specifically includes the rhomboids serratus anterior and trapezius to contract concentrically. We also see a slight forward position of the head from extension of the upper cervical spine and flexion of the lower spine. Again, we see Janet's knees are in full extension, locking the pelvis into a posterior tilt position. This puts tremendous stress on her hamstring muscles, which include the bicep femoris, semitendinosus, and semimembranosus. Before bending, Janet should adjust her center of mass and stand at least shoulder-width apart to create a strong base. She should also keep her shoulders down and back to ensure a good posture, look straight ahead, and stand as close as possible to the object. Here, Janet will flex at the hips eccentrically. This is generated by contraction of the hip extensors bilaterally, which include the gluteus maximus, biceps femoris, semitendinosus, and semimembranosus. She will then squat by creating a slight posterior pelvic tilt and flex her knees eccentrically. The muscles used in this position are contraction of the rectus femoris, vastus lateralis, medialis, and intermedius bilaterally. Janet will also dorsiflex her ankles eccentrically to control the action of gravity. This is generated by contraction of the gastrocnemius, soleus, tibialis posterior, fibularis longus, plantarilis, flexor digitorum, and hallucis longus bilaterally.
so now we've looked at both bending and lifting, we will now have a look at some clips on what kind of injuries you can sustain from poor lifting and bending techniques, and also some tips and tricks on how to improve those techniques.
Back injuries can be caused by frequent or repetitive poor bending and lifting techniques. Pushing the head forward and out of alignment for long periods of time or engaging in activities involving repetitive or forceful movement or awkward positions puts strain on the neck and can lead to pain in the neck and shoulders. Pressure on the median nerve, which passes through the carpal tunnel, is most common in repetitive motion injury. Exercise number 1, hip openers. Stand on one leg and lift the other leg by bringing your knee towards your chest. Then, rotate the moving leg out to the side and then back to the middle. Do about 10 repetitions on each side. Exercise number 2, pectorals dynamic stretch. Stand with your knees slightly bent, then lift your arms upward and open and close your arms rapidly in front of your chest for 30 seconds and then backwards for 30 seconds. Exercise number 3, forward lunge. Stand and step forward, keeping your trunk vertical. Then bend the front leg, keeping your knee aligned with your second toe and your pelvis level. Push back up to the starting position and repeat for about 10 repetitions on each leg.
Okay, so I hope that you've all gained some useful information about our session on lifting and bending techniques around the library. Please remember to fill out your feedback forms, and we do have some time for questions. Okay, thank you.
Yes! Still rolling!
Go 1 down, 2 to go. So let's